Hello everyone, my name is Dr. Kasempa-Monze, and today, March 24th, is World TB Day, and I'm here to raise awareness. It's time to educate, it's time to raise awareness, and it's time to end stigma. What is TB? TB is an airborne infection caused by one of the Mycobacterium tuberculosis complex, either Mycobacterium tuberculosis, Mycobacterium bovis, or Mycobacterium africanum. These are acid-fast bacilli, which basically means their high lipid, waxy coating makes them difficult to decolorize with acids during staining. TB is an airborne disease, which basically means it's transmitted via air droplets from an infected person to a non-infected person or to a latent carrier. Primary infection is basically your first contact with TB, and it's usually asymptomatic. When you see symptoms, that's when you're called a secondary carrier or a secondary infected patient. What does primary infection entail? TB, the Mycobacterium tuberculosis, enters the lungs and is engulfed by macrophages. The macrophages cause granulomas, or commonly known as tubercles, and can even become necrotic or caseating. They are then after spread to local lymph nodes or the rest of the body and other organs via blood or the lymphatics. Now, if you're not in the medical field, most of these terms are probably not important to you. What I'm here to tell you about is how to know that you have it and what to do next. So, what does secondary infection tell? Or what does symptomatic tuberculosis entail? You're going to get systemic features, which is fatigue. You're always feeling very tired out of nowhere. You may not even be doing anything, but you're so tired. And malaise. Malaise is basically a general ill feeling that's something that you can't really explain. Another thing, or other things that you can consider, are night sweats, coughing, weight loss, and immunosuppression. And with night sweats, I don't actually mean waking up and wiping a few drops of sweat off your forehead. No, you're going to wake up and find yourself drenched in sweat. Your night clothes, your beddings are all drenched, your pillow is drenched in sweat. With weight loss, it's not a few kgs, it's about 10 or even more kg over a short period of time. Secondary infection affects multiple organs, and the most common, which you and I most often talk about, is pulmonary TB, or TB of the lungs, which will present with a chronic productive cough, which can progress to a pneumonia, a pleural effusion, and atelectasis. Basically, your lung and your chest won't be feeling well. But you can also have extrapulmonary TB, which affects other parts of your body. It can affect your genitourinary system, which causes you to urinate more. You might even find blood in your urine. You can have skeletal TB, or spinal TB, which can affect your bones, how you move. It can cause fractures that are not aggravated by trauma. You can have abdominal TB. You find a person has ascites, or basically their stomach is getting bigger and swelling up. You can have skin TB and have tubercles, the granulomas forming right on your skin, and so many other different presentations. Now that you know some of the signs and symptoms of TB, what should you do next? Go to the clinic. Don't call your relative that's a doctor. Don't try to tell your doctor over the phone. Don't even go to a traditional healer. Go to your local hospital. When you go to the hospital, healthcare workers will screen you. They will find out what happened, when it started, how you've been feeling, and they will decide what to happen next. If you're a healthcare worker, you probably know what to do, but I'm going to remind you. Isolate yourself. Always have a mask. If you're attending to a patient that has TB, isolate the patient. Make sure they always have a mask if they're leaving the room. Another thing that is very important is to notify the authorities. You're going to screen close contacts of this patient. Preferably isolate these people as well. And then you will go on to treatment. Treatment is nothing you should be scared of. Treatment is supposed to help you. And you should never be afraid to let people know that you are on TB treatment to protect them. So, what does treatment entail? First of all, if clinical suspicion is high, you will be commenced on TB treatment. A lot of people don't understand why they're commenced on treatment even before sputum or chest x-ray confirms that they have TB. If the doctor feels and is convinced beyond reasonable doubt that you have TB, you will be commenced on TB treatment. Now that you know what to do when you suspect that you have TB and what happens when you're being treated for TB, let's learn how to prevent TB. Keep your mask on. We're not only doing this for the coronavirus because there's so many other airborne diseases that need to be prevented. Keep your mask on. If you're high suspicion that you have TB or you're living with a patient that has TB, isolate that patient and keep a mask every time you're interacting with this patient. If you're a healthcare worker, get screened at least every 6 months. Thank you so much for listening. And remember, Speak out, get screened, get educated, and end the stigma, because having TB is not the end of the world. Thank you.